Carpal tunnel syndrome is a condition in which median nerve is a nerve, one of the nerve that supplies our hand, that gets compressed in the wrist due to excess tissue growth due to various reasons. The most common symptoms that patients present with in carpal tunnel syndrome are pain and numbness in the distribution of the median nerve. This is particularly in the thumb, the index finger, and the middle finger. The muscles of the thumb and index finger become weak so that patients cannot grip pen and button the shirt. Those becomes difficult to do. Like I already mentioned, carpal tunnel syndrome is due to compression of the median nerve in the wrist. A certain number of people are predisposed to this, particularly pregnant women, those with thyroid, disorders like hypothyroidism, those with some hormonal disorders, those with rheumatoid arthritis, and recently we have seen carpal tunnel syndrome in like software professionals who use mouse a lot. So the wrist is resting continuously on the mouse pad and it is causing compression of the nerve in the wrist, and that results into carpal tunnel syndrome. The diagnosis of carpal tunnel syndrome is primarily made on clinical examination as well as a simple test which is also known as nerve conduction study. And once the diagnosis is established, then there are various treatment options available for carpal tunnel syndrome. Initially, we tell the patient to avoid all those activities that aggravate the pain. For example, usage of mouse should be discontinued, or they should use proper cushioning when they are using the mouse. They should not do heavy work, lifting heavy weights with that hand. Avoid using that hand for some time till the pain reduces. Usage of wrist splints, particularly during the night when they are sleeping, that also has symptomatically helped a lot of patients. Certain medicines, for example, anti-inflammatory medicines, certain injections like steroid injection or an anesthetic injection inside the wrist can help to reduce the pain in carpal tunnel syndrome. Some patient in whom the compression is very severe and all these measures don't help, we need to do surgery for such patients, which is a simple procedure done under local anesthesia. We make a small cut in the wrist and the nerve is released from its compression, and today, with the availability of microscope and endoscope, it can be made even less invasive in a minimally invasive fashion. The surgery for carpal tunnel syndrome is known as carpal tunnel release, and as I mentioned, it can be done under local anesthesia as a daycare procedure, and patient can be discharged the same day.